Hi everyone, welcome to my 29th week update of my pregnancy. It's kind of crazy, we're at 29 weeks and just one more week we'll be at 30, which to me 30 just seems like a huge number. It's only 10 weeks away, so it feels like it's coming up really quickly, but I'm very excited for it. So as far as his growth rate this week, we've grown a good amount since last time. We're up to 15.2 to 16.7 inches this week, and anywhere from 2.5 to 3.8 pounds, so quite a bit bigger. And with that, he's actually getting a lot more fat deposits under his skin. Remember last week I mentioned that he was still kind of wrinkly in the womb? Well, he's starting to definitely get more filled out, and with that he's actually getting a lot more energy. And I can actually feel that because he's definitely getting more and more active. And it's kind of fun to just sit there and be able to see my belly move. He's still definitely more active in the evenings. I'd say between 7 to 10 is when I feel him the most. During the day, I'm definitely feeling him, just not as often or frequently. And that's pretty normal because they tend to sleep when you're walking around and active, and be awake when you're less active. And in the evenings is when I usually sit down and relax. So it's pretty cool though. Even last night my husband said that when I was sleeping he had his arm around my belly and you could feel him just kicking away in there, so that was kind of fun. So definitely getting more active. And with that, I'm going to be to the point where I start needing to go to the bathroom more and more frequently, because that is one of the many joys of pregnancy. But things are getting a little bit squished in here now, and we'll just continue from here on out. And I'm also noticing that I'm getting winded a bit more easily. Even just sitting down and tying my shoes is a huge hassle. I don't have to tie my everyday sneakers, luckily, but at work I changed from rubber boots to hiking boots. And tying those is just way more difficult than I feel like it should be. So that's kind of a pain, but what are you going to do? One of the many joys of pregnancy. And with that walking around, I just get more winded a lot more easily, especially if I'm trying to talk on the phone or something while walking around. So yeah, that's kind of everything that's going on with us this week as far as growth rate and updates. But our fruit this week is again a vegetable, but we have a butternut squash. My site that I follow actually says it's an acorn squash, but we actually subbed in an acorn squash at a different time when whatever it was supposed to be didn't really fit a good size requirement. And I didn't think an acorn squash would be as big as an eggplant, but a butternut squash is something we found on a different site for 29 weeks, and I think it's a fairly good comparison. And when I say his length, 15.2 inches, that's actually from head to foot, and the fruit comparison size thing kind of goes what it would be like all curled up. So clearly this isn't 15 inches, but it gives a good comparison to what it'd be all curled up approximately. Again, it's not the greatest comparison, but still a fun visual guide. So that's our little fruit for this week. As far as other updates go, I did have a dental cleaning this week. If you guys don't know, they actually recommend you get your teeth cleaned more frequently during pregnancy, because being pregnant and having all the extra hormones can actually affect your gums. It can give you pregnancy gingivitis. It will make your gums a lot more sensitive, a little bit inflamed, bleed more, and that's very normal during pregnancy. It's just another one of the fun side effects. I do have pregnancy gingivitis, but they said that my gums don't look any worse than last time, and it should clear up after the baby's born. So it's nothing too concerning. It's just a little frustrating for me because they're a little bit more sensitive. So definitely something to keep in mind though when you're pregnant is you want to be really up to date on your oral hygiene. It's really important to make sure you do good at-home care for your teeth and make sure you're getting checkups at your dentist. So that I had today, which is never fun, but it's good that my teeth aren't getting any, or my gums aren't getting any worse. So for other updates, symptoms-wise, I actually spoke too soon last week about my heartburn not being around because it did flare up again this week. It hasn't been too bad, but definitely came on a couple times this past week. It's not horrible. I just take Tums or Maalox if I need it, and it's just kind of, you know, it's heartburn. It's very uncomfortable when it's there, but for me it hasn't been completely horrendous or unbearable. I just clearly do not like having it. It also doesn't flare up too often. I've had it 2 or 3 times this past week, so luckily it's not continuous or every day. I just, it's there. So that's been no fun to have to deal with again. But I've also noticed that in addition to getting some hip pain at night, this past week I've noticed a couple times it's almost gotten to the point where my hips get kind of tingly, numb-ish, and I think it's just if I was sleeping in a funny position, but that was kind of a weird sensation I hadn't had before. Still some occasional back pain, but nothing really new beyond all that. I am finding it harder and harder to sleep in. I haven't had too many issues with falling asleep yet. I actually tend to fall asleep on the couch some nights, and then my husband wakes me up and I go upstairs. But Tuesday is my one night a week to sleep in, and I have not been able to sleep in for the past few weeks. This past Tuesday, I actually woke up at 7:15, which is just way earlier than I would like to be awake on my day off. So that's kind of frustrating because I know that it's only going to get worse, and once baby arrives, I'm not going to be able to sleep in for who knows how long. So I wish that I could when I'm able to, but not much you can do about it. I just keep getting sleep when I can and trying not to stay up too late, which is easier said than done. Considering Josh gets out of work at 10 p.m., I usually stay up until he gets out. Sometimes, like I said, I'll fall asleep on the couch, but usually I'm awake at least till then, and then for a while after that. So that's kind of it for symptoms, though. Nothing major. We'll see as time goes on and I get bigger and things get more squished. And I'm sure I'm going to become more and more uncomfortable. Right now, like, people ask me if I'm sick of being pregnant or if I'm really uncomfortable yet. And I wouldn't say that I'm either of those things. It's not to the point where I'm horribly uncomfortable. I definitely feel big. And I don't like getting winded as easily as I do and having a hard time bending over. But it's definitely not unbearable or super uncomfortable for me yet. So we'll see as time goes on. So let's give you guys a quick view of my belly here. So I feel like there isn't that much of a change from one week to the next, but when looking at it, at my photos, I can definitely see a difference between last week and this week. So here's my belly. It's definitely getting a little bit bigger as we go on. So that's kind of exciting, and at the same time, I feel like I'm giant. But so that's it for this week's update. I didn't mention I am using a new camera, so I'm hoping that this will kind of up the quality of the videos and actually help me upload them faster, because it takes about 3 hours for me to upload from my other camera to YouTube, so I haven't been able to get them uploaded the same day I take them. So we'll see if this makes a difference, and then hopefully the next video I take, if this works out, will get put up a little bit before hand, and it won't wait so long. So that's it for this week. Thanks everybody for watching. I'll see you next time.